Now, the most live local talk with Paul Vandenberg.
All right, we are back. No, you don't need to wear those. You're all right. You guys don't need those. Dr. Julie Morison and Helen Carroll, everybody. Here they are. Dr. Morison is a local psychologist, specializes in eating disorders. She runs a program that helps people with them. And she's well known in this community, the ED, if I may. Eating disorders community in the area. How are you?
I'm good, thank you.
Helen Carroll's also with us. Helen, and her husband, along with their daughter Natalie, have started this NEDA walk here in the Capital District. It comes up this weekend. Is that the what's the N stand for?
National Eating Disorder.
I had no idea.
Yes.
And Helen is here along with Dr. Morison. Okay, you okay, Helen? Everything all right?
Yes.
All right. Let me start. First of all, let me start with the background on the walk. The walk takes place Saturday. Where, how, what time? Is there a website? Give me the whole. Give me everything.
Yes, the walk is this Saturday. It starts at 9 o'clock. Mm-hmm. It's at the Crossings in Colony. And the registration is 9 o'clock. There's some activities going on. There's face painting. There's some hair extensions. There's informational tables. There's going to be music. The walk kicks off at 10 o'clock, and then there'll be some closing ceremonies. It'll all wrap up at 12 o'clock.
At noontime?
Yes, at noon.
Oh, that's not bad.
No, so it's a morning activity if you're free that morning. The website for registering is www.nedawalk.org/Albany 2014.
That's nedawalks.org/Albany 2014. Okay, you did a good job here, except for that MC. How'd that happen? That MC, Angela's going to be the MC?
Angela Rossetti's the MC for the walk.
Okay, well, hopefully it'll work out for you. She'll do a good job.
Got our fingers crossed.
Yeah,
we know
that's right.
she will.
There you go. That's day to day around here. But no, that ought to be fun. It'll work out good. Dr. Morison, who works with people, she's a psychologist, specializes in eating disorders. What are we up against here? How bad is this? How widespread is this? How bad is it?
It's pretty bad. It's more widespread, I think, than most people know. We tell people the statistics are 1 in 5 females will have an eating disorder in their lifetime, but also 1 in 6 males. We usually surprise people when we say that. A lot of people are used to the whole idea that this is a disease for females only, and it's certainly not.
Okay. You see, I go through these periods where I can't stop eating myself.
Mm-hmm. Well, you know what? It's interesting. I think a lot of people, there's a spectrum, right, for anything. So there's disordered eating, there's serious eating disorders, and there's stuff that sort of falls somewhere in between. Okay. I think that when we look at eating disorders and we're wondering how severe they are, our biggest question is, how much is it interfering with your daily life? And that's what we do for everything. You know, it could be depression. People can be sad from time to time, but are you somebody who can't get out of bed?
Well, what's the trigger point, doctor? It's somebody listening right now that has an eating disorder. They know something's wrong with them. They're not sure, but it is an eating disorder. What tips you off? What gives you an idea that they have an eating disorder?
Well, some stuff you wouldn't know. Some people you wouldn't be able to tell at all. Now, people with anorexia nervosa are significantly underweight. It's just part of the diagnosis. So some people would say it's easier to spot them. But people with bulimia, for example, those patients aren't necessarily underweight. And the thing with eating disorders in general is that they're very secretive. So if somebody's struggling, you may not know. And I think the biggest question is, does the person acknowledge that it's something that's getting in the way? Okay. And if they do, then it's disordered.
Okay, but it's not just a case of being way underweight or being way overweight. Many times it's something in the middle, right?
It's not just about weight. And I think that's the bigger thing, is that I think a lot of people, when you talk about eating disorders, you ask somebody on the street, they're going to say, oh, it's about weight and how you look, or they're going to say it's just about food, and it's not about that. I think what happens over time is that someone with an eating disorder develops sort of the need to maintain it, and it takes on a life of its own. Sort of having trouble to even believe I could have a life without actually needing my eating disorder.
All right, let me hold you right there. Dr. Morison is here. Helen Carroll are here. We'll hold them for a moment while we talk to Larry King. This weekend is the big National Eating, oh boy, I'm going to get this wrong here, Helen. Help me out a little bit. The National Eating Disorder Association Walk. There we go. It's NEDA, NEDA. The walk is coming up this Saturday. It starts at the crossings at Colony. Pre-register there Saturday morning. All the information you need you can get by going to nedawalks.org/Albany 2014. That's NEDA walks.org/Albany 2014. Helen Carroll is here. Her husband and their daughter are the folks that started this walk here in the Capital District. Their daughter, Natalie, recovered from an eating disorder. Dr. Julie Morison is here, local psychologist who specializes in eating disorders. She runs a program that helps people with them. And tell me about your affiliation here, Julie. If somebody's interested in being a part of your association or getting more information, where do they call?
So they can call us, and they can even ask to speak to me. We can do consults and check and see where people are at. Our practice is called, we have two practices. One is called Health Psychology Associates, and the specific eating disorder treatment is called Livewell. At Livewell, we provide patients with everything from individual psychotherapy to what we call intensive outpatient treatment. And that intensive outpatient treatment is really driven to create a very structured treatment program, but allowing people to stay home in their environment, stay in school, that kind of thing. They can call us at 518-218-1188, or they can even go online to learn a little bit more about our practice and about what we offer. Our website is albanyhpa.com.
Tell me, who's the person that calls you?
You know what? A lot of people call. It's a really good question. Thank you for asking that. So we get calls from doctors who say, I got this, I got this patient, I don't know what's going on.
Yeah.
We talk
That
to
makes
parents
sense.
who say same thing. People call for themselves. People call for friends.
Right.
Pretty much, it's one of those things where, and it's something we encourage people to do, if you have any concern about anyone, or you start learning about this stuff because, say, you go to the walk and you get some information, give us a call, even if it's a consult to say you do or don't need treatment, or here's how, if you were a parent who's trying to get their kid to agree to treatment, this is the way that we would handle it. There isn't a question we won't answer.
Okay. Helen, tell me about Natalie. How Natalie, her age, how this started, what happened? Tell me about her.
Yep. Natalie's a senior at Holy Names High School.
Oh, she's a high school senior.
She's a high school senior.
Boy.
So she came down with an eating disorder. We discovered that she was struggling with an eating disorder when she was in 9th grade.
Which degree was it, Helen? Did she too much or too little?
Too little.
Too little, okay.
And it started out as what we thought was a good thing.
Which is common, right, doctor? That's really,
very
all
significant.
right,
Yes.
okay.
Yep.
And she started out with, she was doing some sports, and she said, I want to eat healthy. So we said, well, that's good. You want to eat healthy, makes sense. And then we noticed that she got more and more wanting to eat healthy, but we were thinking, wow, it's healthy, but it's less and less actual food that she's eating. So at one point we said, well, let's talk to a doctor and look into this. And she started down that path of restricting food and getting thinner and thinner, to the point that we did have her go to an in-treatment facility. And as Dr. Morison was saying, as a parent, sometimes you have to step in and get involved because your child isn't looking at things clearly.
They're incapable of controlling themselves. Is that fair? Even if it's just for a temporary period, doctor, somebody has to step in and try to help them out.
I think a good way to look at it is there's no insight.
Right.
I think it's more about fear about making a change because they feel as though they desperately need it. I think it's more fear-based than it is about not being able to control one's behavior.
Well, also, there comes times in our lives when somebody else just has to step in and kind of put us on the right track.
That's true.
And that's pretty much, it sounds like that's exactly what Helen and her husband went through. You step in, you get them back on track, and they go on with their life.
Exactly.
It's always nice to hear the story, though, about somebody that, everybody's still around. You got through a really hard time.
Exactly.
And it's been working. How long has this been working for her?
She had her last time in treatment beginning of 10th grade, and then she's been steadily improving since that time.
Oh, so it's been a couple of years.
Yes.
Oh, good for you
yes.
guys.
And she's taken that extra step of saying, hey, I've dealt with this illness. I feel good about it, and I want to get the word out that it's an illness that you can deal with and be successful at and move on.
Okay, so you got Angela emceeing this thing Saturday. All right.
Sure do.
All right. This goes on Saturday. It's the walk for the National Eating Disorders Association. and they continue to wage the battle against eating disorders and unrealistic body perfect ideals that people seem to have. The event is Saturday, this Saturday at the Crossings at Colony. You can go to the website and get more information at NEDA Walks, NEDA Walks.org/Albany 2014. All right, this is grassroots. There's a lot of people involved here. We want you to be there. They'll do the walk in the morning. Everything should be wrapped up by noontime.
Exactly.
That sounds like a good day. Anything I missed, Doctor?
No, I think the only additional thing, and Helen and I are in agreement with this, if there's people who are listening and this is drumming up questions and wanting more information, coming to the walk is an excellent opportunity. I will be there. Other practitioners will be there. Parents of folks who have had eating disorders, patients themselves, to ask questions and follow up, get some information.
Okay, my only question is, how'd you get on with Cody before you got on with me? How'd this happen? I mean, can you believe this, John? They got on with Cody before they come over here with me?
Magical. It was just magical.
It must have been.
I don't know what else to tell you.
It's nice to meet you. Good luck
Nice to meet
Saturday.
you too. Thank
Good luck
you.
Saturday.
Thank
Good
you
luck,
very
Helen.
much.
Saturday.